Welcome to this explainer. Look, if you or someone you care about is seeking help for substance abuse, you already know that finding the right support can feel like navigating an incredibly complex and, frankly, completely overwhelming maze. The stakes are so high, and honestly, the sheer volume of options out there can be paralyzing, but it doesn't have to be. Today, we're unpacking a definitive 15-question roadmap right from the research. It's designed to guide you step by step toward making an informed decision, and really, to set the stage for lasting recovery.
To understand why making the right choice is absolutely critical, just look at this staggering figure. According to SAMHSA, that's the Substance Abuse and Mental Health Services Administration, in 2022, 48.7 million people aged 12 or older needed substance use treatment. Just let that sink in. That is an enormous portion of the population struggling, seeking a way out, and desperately needing appropriate care.
Now, what's really interesting about this slide is the stark contrast presented in the data. Out of those nearly 49 million people who needed help, only 7.6% actually received any care. Over 92% did not. And this right here anchors the absolute urgency of not just finding a facility, but finding the right facility. The gap between needing help and actually getting effective help is massive, and asking the right questions is exactly how we bridge that gap.
So, to lower the anxiety around this whole process, we're using an inside-out approach. We'll be looking at 5 key areas today: assessing your true needs, evaluating treatment and staff, checking accreditations and environment, logistics and aftercare, and finally, spotting those red flags.
All right, let's jump right into Section 1, Assessing Your True Needs. This is all about the internal prep before you start the external search.
Think of this as your personal internal checklist. Before you even pick up the phone to call a center, you need a clear understanding of these 4 factors. First, how severe is the addiction? Second, are there other mental health conditions at play? Third, what exact substance is involved? And fourth, what does their previous treatment history look like? Honestly, having a clear grasp of these 4 things makes every single question you ask a potential rehab center exponentially more effective.
Okay, let's dive into this clinical term for a second: dual diagnosis. Many individuals struggling with substance use are also battling things like anxiety, depression, or trauma. If that's the case, it is absolutely vital to find a facility that is equipped to treat both conditions at the exact same time. You literally cannot effectively treat the addiction while ignoring the underlying mental health issue. Holistic healing means you have to address the whole person.
Building on that, different substances demand highly specific treatment approaches. Take opioid addiction, for example. It often requires medication-assisted treatment, or MAT, to manage cravings and withdrawal safely. Knowing the primary substance is a totally necessary first step because it lets you instantly filter out facilities that just don't specialize in the precise medical care you or your loved one actually needs.
Moving on to Section 2, Evaluating Treatment and Staff. This is where we ask the right clinical questions.
So this is where you put your detective hat on. These are the foundational questions you must ask regarding their program. What modalities do they use? Are we talking cognitive behavioral therapy? Dialectical behavioral therapy? Do they have an on-site medical detox so that initial withdrawal phase is safe? And what levels of care do they offer? Actually, data from the National Institute on Drug Abuse shows that combining behavioral therapies with medication is the most successful approach. You want to hear the staff enthusiastically detail their evidence-based practices. Now, here's a question I want you to ask every single time. What is your staff-to-patient ratio? A lower ratio translates directly to the personalized attention and individual therapy that is just so necessary for real recovery. Because, think about it, if the staff is stretched way too thin, your loved one won't get the tailored deep dive therapy they need to uncover the root causes of their addiction.
And who exactly are these staff members? You've got to ask about the specific licenses of the clinical team. How do they handle dual diagnosis on a practical, day-to-day level? And what is their approach to family therapy? The American Psychological Association actually stresses that treatment tailored to an individual's specific needs, and that includes family dynamics and co-occurring disorders, significantly improves outcomes. This kind of integration shouldn't just be an afterthought, it should be completely non-negotiable.
All right, Section 3, Accreditations and Facility Environment. We're checking the standards and the daily life here.
First things first, accreditations from bodies like the Joint Commission or CARF are absolutely non-negotiable, period. They prove that a facility actually adheres to rigorous quality standards. But beyond the paperwork, ask them about their philosophy on relapse. A truly reputable center views a relapse as a symptom of a chronic disease and a chance to adjust treatment, not as a failure or a reason to just kick someone out. Also, you want to ask about the typical daily schedule and the rules on things like electronics and visitors, just to make sure the environment promotes focus and a solid routine.
Let's shift into Section 4, Logistics, Costs, and Aftercare, Planning for Long-Term Success.
This is such a brilliant question to ask any admissions director. Ask them point blank how they measure success. Now, while exact success rates can be notoriously tricky to calculate, reputable centers track their effectiveness and outcome metrics. If they kind of dodge the question or can't answer it clearly, it shows they might lack the accountability and commitment to long-term patient well-being that you completely deserve.
You also need absolute financial transparency from them. Get a clear breakdown of the total costs, what insurance covers, and any copays. But don't just stop at the money. Ask about aftercare. Comprehensive planning that involves sober living options and alumni networks is absolutely crucial. Oh, and it's also worth asking about innovation. Some modern centers are utilizing hybrid telehealth models for better flexibility, or even tech-assisted therapies like virtual reality for coping skills training. These can provide some really incredible new avenues for engagement.
And finally, Section 5, Spotting the Red Flags, Protecting Yourself During This Search. And this brilliantly illustrates the difference between a good choice and a dangerous one. A reputable center is going to offer transparent costs and highly individualized plans. They give you the space and time to make a decision. Red flags: high-pressure sales tactics trying to rush you into committing, a lack of transparency around what their staff is actually qualified to do, vague answers, and crucially, a one-size-fits-all approach. Addiction is incredibly complex, guys. If a center claims to treat every single patient exactly the same way, run the other way.
So, the takeaway here is that after you've asked these 15 questions, you need an action plan. Reflect on the answers they gave you. If you can, go visit the facility in person to check the vibe for yourself. Always verify those accreditations independently on their respective websites. Consult with trusted advisors, whether that's your doctor or a therapist. And then, after you've gathered all the facts, trust your gut feeling about that center's ability to provide compassionate care.
I really want to leave you with this empowering realization from the research. Finding the right support is a testament to your strength and commitment to a healthier future. Seeking help is not a weakness. It is literally the ultimate display of courage. You have the tools, you have the roadmap now, and you are entirely capable of making an informed decision.
As we wrap up this explainer today, I want to leave you with a quick question to ponder. Based on your own internal assessment, what is the one non-negotiable feature that you need for your recovery journey? Is it a dual diagnosis specialty? Is it family therapy? Figure out what that is right now, write it down, and let that guide your search. Take that first step today. Thanks so much for joining me.